This is a video on how to do a KOH scrape and prep. So you're going to use 2 glass slides for this. The first glass slide is going to be placed firmly below the lesion that you want to scrape. The second glass slide you're going to hold between your thumb and your index finger, and you're going to hold it perpendicular against the skin and scrape firmly, but not too firm as to draw blood, very quickly, like this. And now you see the scale is on the slide. Now that you have the scale on the slide, you can use the other slide to organize it so that it will all fit underneath one cover slip. Like this. Next thing we're going to do is take the KOH. You can use either 1 or 2 drops depending on how much scale you have. Next thing we're going to do is place the cover slip on over the KOH. So you're going to do this at an angle to prevent bubbles. So we're at an angle, and then we slowly lower the cover slip down, like so, to prevent bubbles. This is what it looks like once you have the cover slip on. Some people like to use a flame to help destroy some of the scale. You'll pass the flame underneath just a couple of times to heat it up without boiling it. Like that. And if there's any char underneath the glass slide, you can use some alcohol to clean it off to make sure you get good visualization with the microscope. If there's any char from heating up the bottom of the slide, you can simply use an alcohol pad to rub the bottom of the slide and remove the char to make sure that you have good visualization with the microscope. Okay. Of course, you should be wearing gloves for the whole procedure. The next step is to take the slide and put it on the microscope. Then we're going to center the area with the cover slip underneath the lowest power. So you need to make sure that you're on the lowest power. Next step, turn on the microscope and position it so that the area that you think has the most concentrated amount of scale is underneath the light. Now we found the scale on low power, so we're going to move to medium power. And right in the middle is the area that we're looking for. Now we're going to move to high power. And as you can see, we need to do a little bit of focusing. So there, you can see all the little lines. Those are the hyphae that we're looking for.
Go back up out of focus.
So now we're out of focus. We're going back down towards focus.
The first thing that comes into focus are the hyphae. Go down lower into focus. And you're going to see the outlines of the keratinocytes next. And now
as we go back up, there's the hyphae again.
Back up more, and back down. So you can see that the hyphae come in and out of focus. Fantastic. So this is a positive KOH.